Hey guys, welcome to another episode of the Question Bank. Today we have a psychiatry question. So let's take a look at this question. We have a 28-year-old female with a history of schizophrenia who is admitted for inpatient management. A first-generation antipsychotic medication is administered, and several hours after the first dose of medication is given, the patient develops involuntary muscle spasms, and on examination, the patient's head is turned to the right side and fixed. Which of the following medications can be used to treat the patient's new condition? So we have a couple of key points over here. Let's go through it. So we have a 28-year-old female. We need to make sure we know our demographics of the patient. We also have the information that she has a history of schizophrenia, and she's admitted for inpatient management. So possibly she's had an acute exacerbation, she may have had a psychotic episode, and she's admitted for safety and for monitoring her medication and her response. So she's given a first-generation antipsychotic. They haven't specified it, so we can assume it could be, for example, haloperidol that's been administered. But first-generation antipsychotic, the moment they mention a generic sort of category, we must think, okay, it's something to do with possibly side effects or contraindications because it has to relate to all first-generation antipsychotics. And several hours, what do we know? She has a side effect, which means she has involuntary muscle spasms, and the patient's head is turned to the right side and fixed. Now, what do we ascertain from this? She possibly has torticollis, also known as, in this case, an acute dystonic reaction. So that's what we're dealing with over here. This is our key sort of deduction from this case. Now, what is the question asking us? Which of the following medications can be used to treat the patient's new condition? Okay, so let's go through our medications. Lithium. What is lithium? Lithium is a mood stabilizer typically used to treat bipolar disorder. It's the first-line treatment for bipolar disorder. Is it used to treat acute dystonic reaction? Absolutely not. So we can cross this out. Benztropine. What is benztropine? It is an anticholinergic medication that can be used to treat some of the extrapyramidal side effects caused by antipsychotic medications. So let's keep this in check. Lamotrigine. What is lamotrigine? It is primarily an antiepileptic medication used to treat kinds of seizures, but lamotrigine also has a use in the field of psychiatry, which is to treat mood disorders such as bipolar disorder. Is it indicated in dystonic reactions? Nope. So we can cross that out. Labetalol. Now, labetalol is a beta blocker that can be used in an extrapyramidal side effect, but is it used for acute dystonic reaction? No, it is not. It is used for akathisia. Akathisia means restlessness. So labetalol would not be indicated over here. Olanzapine is a second-generation antipsychotic, and olanzapine is very important to use for conditions such as schizophrenia. Obviously, side effects include metabolic syndrome, so this is something to be aware of, but is it used for acute dystonic reaction? No, it is not. Tetrabenazine. Tetrabenazine is interesting. Tetrabenazine's mechanism of action is still being researched upon. However, it is known that it reversibly inhibits the vesicular monoamine transporter 2, or VMT2. Alright? So it causes a reversible depletion of monoamine neurotransmitters such as dopamine, serotonin, norepinephrine, and histamine as well. But is it for acute dystonic reaction? No, it is not. This is used to treat tardive dyskinesia. Alright, so we are left with one medication that will be appropriate for this patient's condition, which is benztropine. Benztropine is used to treat dystonic reactions. Hope you guys enjoyed this video and stay tuned for more.